It's a pleasure to be here to show you our data. Usually, our country, we tend to have poor data. We are probably not probably, unfortunately, we are the Western European country with the worst rates of cervical cancer. But one thing we are doing right is vaccination, and there's some history behind this. And it's quite a long history. It started at least in 1965 when we started a national, universal, free, accessible to all residents, regardless of being citizens or not, of vaccination. And this plan has been ongoing ever since. It's updated as needed according to new data. It's available in all primary healthcare centers, and everyone is supposed to be registered in one of these public and free healthcare centers where they have their GPs, they can have all the primary care. And despite having this need to be registered in one of these centers, you can have your vaccines in any of these places, regardless of whether or not it is the one in which you are registered. Um, this plan is highly recommended, but not mandatory, except for the vaccine for tetanus and diphtheria, which, according to the law, is mandatory for those attending school or to take exams at school. Nevertheless, the Constitution says that schooling is a right, it's a universal right. So, in practical terms, none of these vaccines is mandatory. While one law says it is mandatory, you have the right and it's mandatory to go to school. So, if the parents refuse to have vaccination for that child, they are entitled to. So it's a legal controversial topic. This is the last version of our vaccination plan. And how things work, well, every and since once a child is born, that child is entitled to be registered in one of these centers and is in those lists. And so the nurses will call and recall if there are no shows for vaccination. This is our plan for HPV. We started vaccinating with Gardasil in 2008. We started with 13-year-old girls and when the catch-up phase for those who were 17 years old. In 2014, we reduced to two doses of still Gardasil at that time and only for girls. In 2017, we changed it to Gardasil 9 and still was only for girls. And since 2020, we started vaccinating also boys. High rates of vaccination is not a new thing in our country. We made headlines during the COVID because we also reached really high levels. And in fact, if we see the expected coverage rate for all vaccines is of 95%, and we achieve it for all vaccines. The cutoff is slightly lower for the HPV vaccine, in which it was established to be at 85%. And we achieved it, and apparently COVID had little to no impact in this. For the first dose, coverage rate is very high for both boys and girls at 92 and 91% respectively. For the second dose, it seems to be lower, but probably it's a bit early to reach conclusions. For the second dose, we have 89% for girls and 80% for boys. And it stopped. Yeah. So what, in our opinion, what explains this success? This history of an organized vaccination plan, the existence of an organized public health system which is free and available to everyone, not only for citizens, anyone who is resident in the country is entitled to it. The system in which the parents or the adults will receive a message or a phone call to go to get the vaccines. Healthcare professionals still do have some credibility, contrarily to politicians. There's a widespread belief that vaccines are mandatory. That's not really the case, but most people do believe that they have to do it. I think there have been good communication strategies from the health ministry in terms of vaccination, how important it is, how good it is for the individual and global health. I think some cultural factors may also play a role, like when you say that if you are vaccinating, you are protecting your child, and for instance, for the flu, you are protecting your parents, your grandparents. I think it plays a lot on people's minds and probably contributes to the overall high rate of coverage of vaccines. And we are lucky to have a low impact of anti-vaxxers at the moment. We already can see this effect in when we compare cohorts of vaccinated versus unvaccinated women. We see that similar to what we've seen before in Argentina, we have a 90% drop in the rate of HPV 16 and 18 in the cohorts that were vaccinated at younger age, the ones that were vaccinated in that catch-up phase. The reduction was not so obvious, but nevertheless, I think we still face risks. The anti-vaxxers movements tend to grow and to gain weight, especially due to social media. These days, it's really easy to spread these messages. We need to keep measures of strong vaccination and screening campaigns and policies for immigrants. We have currently a very high number of immigrants. We are a small country, we are around 10 million, but 10%, according to the last data that we have from 2023, 90% of the population are immigrants, most of them coming from Brazil. And in these women, the vaccination with HPV vaccine is quite low. So we are now facing, we have different cohorts. We have non-vaccinated women. We have women that were vaccinated at 17, women that were vaccinated at 10 with 3 doses, with 2 doses. And adding to this, now we have a huge group of women that are at risk and that were not vaccinated. And this obviously is putting quite some stress in our healthcare system, which is not actually living its best moment. This is a different perspective, and that's one thing I'm proud of. In my hospital, we started in June 2022 a program in which we offer, the hospital, the state offers the vaccine for women who have a diagnosis of high-grade lesion of the anogenital tract. And this is a project that we started, that it's being followed now by some hospitals. It's not a generalized thing yet in the country, unfortunately, but we believe it will be one day. So in terms of conclusions, the HPV vaccine coverage is actually slightly lower than it is for other vaccines in our country. It's slightly higher in girls than in boys. I'm not so sure our model is replicable in other countries. I think cultural factors play a role. There are historical reasons. There's a free health system. And we can never assume our results are taken for granted. We are permanently at risk. We must always be on watch, as these things can change really fast. We had as experts in the country who were discussing that we definitely we needed to change the screening entering age. We were pretty sure that we could start at age 30 to our high coverage. These days, I'm starting to have doubts, as we have many young women with a different profile, not vaccinated. And that's what I had to tell you. Thank you.